Good afternoon, everybody. It's John Ross with the XPian Daily News Report. For Wednesday here, we're taping this a little early, but this is for Wednesday, St. Patrick's Day, March 17th. And we got a special guest. We were going to have a mystery guest, but I didn't change that there. It's guest. We have a guest here, President, CEO of the Visiting Nurse Association, their healthcare president. We got Linnea Windel with us. Linnea Windel. I don't know what am I doing this bad for here. I'm getting old here. Now we're going to bring up Linnea here, and I should know that better because that's a good Swedish name. And here she's coming here. And Linnea, I'm sorry about that. I don't know.
Oh, no worries.
My mind just went blank there or something. I don't know.
A hard name.
I know. I think we talked about this before. I know another Linnea, a young girl from Swedish background, and I met a relative in Wisconsin, but I don't know if she's alive or not. But that's a flower in Sweden. So we got a lady that represents a flower with us here, and she's going to just talk about the healthcare, what's happening with the visiting nurses, and what they're doing in the Fox Valley and in Aurora. And so I just want to again thank President Linnea for being with us here, and it's a blessing. And President Linnea, give us a little update, and we'll talk about other things too. Just generally, what's been happening there at the VNA, and we'll talk about the other issues too that are out there. But there's a lot of issues. But just give us your little thought for today, or what's the big thing happening, and how things are going there at VNA.
Well, thanks, and good afternoon. Things are going well. Plenty going on. We continue to provide medical care, a lot of in-person visits, as you know, and we still have telemedicine available. So if that works better under certain circumstances, we still provide that as an option for getting care. We provide a whole range of primary care in our clinics with obstetricians, pediatricians, family practice doctors, internal medicine, and some specialties too, like podiatry rather, and dental, optometry. And then there's a whole home care division, so nurse practitioners and nurses making home visits. So plenty going on.
Yes, I know there's a lot going on, and you've been very involved in this COVID-19 response. Your people have in various ways. At the bottom of the screen, I got about the testing that you can get with the VNA. We'll touch on the testing first here, because that's what's happened earlier. How's that going? And I think we mentioned a little before we got on air that it was a little less on that, but how overall has the testing been going?
We're providing testing at our Highland Avenue location in Aurora, plus Elgin and some other places too. The demand is a lot less for testing right now because fortunately the positivity rates have overall been declining. So that's good news, which means less need for testing, but we have it available should people need that. We're doing a lot of that is done outside in our drive-up.
Okay, nice.
Yeah.
Do you know anything about the variants? Or have we seen any of those in King County? You know anything on those type of that fact? I know nationally, and they talk about. I think they've said it's in Illinois, but I don't know.
Yeah,
I don't know more than I've just heard that. I don't know. Do you know anything more about variants in King County?
Yeah, I think we've seen it in Cook. Has been the closest that I've seen.
Yeah. Well, we hope that doesn't come our way. That'll increase a lot of different things here if we don't get our shots in, it's a big worry. I know Dr. Fauci's been worried about this, and it's
Mhm,
happening in Europe right now.
mhm,
And we still got to keep wearing those masks and everything along that line, and the good social distancing. But
mhm.
even if we get the shots here, we got to keep vigilant. In other words,
Right.
I
Yeah.
know that's a tough one to say, dude. I don't. It's just
Yeah, I know.
yeah.
It's hard, but we're still need to do all those things while we're working on getting vaccinations done. So you're
Now,
absolutely right.
uh yeah. So we're into vaccinations also, and
Hmm.
you're one of the groups that offer appointment vaccinations. I mean, but
Hmm.
you don't call. I want to emphasize this, and I know you
Hmm.
will too. You don't call the VNA that number that we have down there. You use that website we got at the end
Right.
there,
Right.
VNAhealth.com, and then the COVID dash vaccine, and
Hmm.
then they'll go through like an online thing, right, to get registered there. And I
Right. It's a wait list that people can sign up on. And you're absolutely right. All that's done online, and you can find it on our website in the COVID-19 section.
now I noticed that you do bilingual there. So if
Mhm.
somebody has a Spanish background, I mean Hispanic background, you can work at it. I mean, you got to push a few buttons there, but it goes to it's bilingual,
Yeah.
and so that's very good.
Hmm.
And so over the last weeks, how many? I know when we talked, I forgot when we talked about it. This was a couple of months ago. Maybe we
Hmm.
talked last, and you said you were you were you were saying we might not get the vaccine till April or something. I remember I
Yeah,
forgot.
that was
I know it was. I
that,
thought it was April. Maybe you said. I remember that much, and I
yeah.
forgot. But we've got it earlier than April, so this is very very good.
Yes.
Yeah, and so how many weeks you been doing this about? You've been doing it a few weeks at least, haven't you?
Right. Yeah, we started the very end of January,
End of
and
January, right? Wow.
mhm, and we started with, of course, the first phase with healthcare workers, and then once that expanded, we were able to, uh, kind of follow those guidelines and open that up to the next group based on age and essential worker occupations. And so so far we've done about 15,000 doses, and we're up to now doing about 300, 350 at our Highland Avenue location a
Wow.
day. And then we do some special events too. And we have vaccinations going on in Elgin and in other locations. So, all told, we're up to now about 3,000 doses a week that we're giving, and the majority of that's in Aurora.
Wow, that's very good. And oh, uh so what select groups are we at right now? Are
Hmm.
is it I know I'm a 1B because I'm older, and then there's a I guess they call it 1B plus. I guess that's when you have more medical things, but
Yep.
you're not 65.
Uh-huh.
It's 65, right? Wasn't the year now is 65 and
Mhm.
above for 1B?
Right.
And this 1B plus is anybody that has these other health issues, right?
Right. So, folks that are eligible could be based on age, it could be based on their occupation, one of the essential workers
Right.
that is, outlined, and then now certain medical conditions and factors. Yep.
And you got a very good thing on that. Your site has it explains that real well. You hit the buttons there, and it shows all the different
Hmm.
levels there. It's a very good on that site. I thought that was real well done, and it's
Oh,
so you
thanks.
can know what level that you're at.
Hmm.
Now, I don't know when this is going to happen, but I know I have friends in Chicago. I just found out well, it's been talked about the last few days, and they've got their vaccination, even though they weren't, in that any age group. They're a younger age group, but they're just by zip code there in Chicago. They went to the United Center and they're giving everybody in a certain zip code.
Hmm.
Now, I don't know when that's coming. Kane County, I don't think has said that yet, right? They,
Yeah, I don't think we have the exact timetable for that yet.
yeah, well, they have to have a good amount of vaccine too to do these things because we
Mhm.
want to make sure we get everybody that's on that 1B group and 1B plus group,
Mhm.
and teachers too that are out there, get everybody to get that vaccination. Now,
Mhm.
I think I told President Linnea that I was a bad kid and I went to another site. It was on the county site though. I was county though. They it was about the only. I'll be straight with you. It was about the only one that worked really too. Was Meyer. I think they're getting a little better. All of them. Most of them said that it was like 25 miles away to get a pharmacy shot, and they won't even take you online. So, but I did register at Meyer and got my shot, and they got another one due in. Oh, President Linnea, we got to get people to think this way. See, there's my card. It
Very
proves
good.
it,
Yes.
it proves that what happened. I want to bring up the proof. Uh,
Congratulations. That's great.
but anyway, I had it at Meyer, and I got another one due on the 24th, and then 2 weeks after that, I guess we're in, I don't know, better shape. I don't know why I say perfect, but uh, so and I had the Pfizer one. That's the one you've been using mostly right now, Pfizer one,
Actually,
or are you doing the Johnson and Johnson one, or what? Or what?
no, actually, so far we've administered only Moderna.
Moderna. Okay, well that's a similar
Next
at
next
Pfizer.
week we'll be administering some Pfizer, so we'll be
Now,
adding that one.
now some say that maybe in certain areas they should use Johnson and Johnson because people, not so much about how efficient they are, but mostly people coming back, in other words, so they don't have to come back.
Mhm.
Certain
Mhm.
age groups, maybe homeless, others, so you don't only have to do it only once.
Well, I think I heard somewhere somebody said was quoted as saying, "Well, which is the best choice for the vaccine?" And the response is, whichever one is being presented to you." Yeah,
That's true. That is true. We can't get, no, we can't get
because
that picky here. No, we can't. And they all seem like they do good. And
right,
the one on the Johnson and Johnson, they say, it didn't do this or that. Well, they were all tested at different times in different
right,
places. So
right. Different places, different, in the context of some of the variants. So
it's very
it's
hard to
hard
say
to
that one is
compare.
per se. They
Really,
all seem like they prevent, quote, death. That's what we want.
right? Exactly,
I,
exactly.
I
Yeah,
think they've all been pretty good on that front. They say
right,
100% on that
right.
front.
Yeah,
So that's a very good thing. And
just because.
so we have opportunities to get your vaccinations. How far out are you on the registrations here? Is it a couple weeks, couple days? How does it look normally, would you say?
Yeah, that's hard. That's hard to predict because of the vaccine
Oh, the
amount.
availability?
Hmm. So yeah, so we've had variations from week to week, a little bit on how much vaccine we have. So it's hard to say exactly. I mean, at this point, there's still a lot more people that want vaccination than there's vaccine available. That is still a general,
Okay, it's still
that is,
happening.
that
Okay.
is still a general issue. Yeah, and that's why I say, if you have the opportunity to get vaccinated because they they do prevent, all of them have been shown to prevent death. The benefit of proceeding when you can is really a good thing to go ahead.
It's very important. I think that's very good, President Linnea, and that we got to get our vaccinations, and everybody's got to get those. On your site, you you register, but you might not be able to get in or whatever, but you can register there, right?
You register, and then you're essentially filling out an online form which tells us about your eligibility phase.
Right,
And then, based on the amount of vaccine we have, um, and then we essentially send to the email that was provided
right.
a voucher to make the appointment.
Okay. What I'm saying is you do get to register. That's what I'm
Yes.
saying, going there, because I've had some, I think I mentioned earlier about my with getting my one with the county through these pharmacies. Some of them wouldn't even take me because it's a,
Mhm.
you know,
Yeah.
they weren't
Yeah.
around or whatever.
Right.
And I
Right.
just read today that the CBC is finally coming more on board. That was one that was listed, but they had no sites. I go, I don't know
Uh-huh.
where. Or
Yeah.
they did, like in Belleville, Illinois. Uh, but I want to say people are interested in getting vaccinations. I have
Yep.
a friend, well, I heard another person too. When the person went down to Pekin, his wife was a 1B, and he went to Walgreens in Pekin to get a shot.
Wow.
I go, I should have pushed more with you folks, you know. I mean, at least I didn't have to go to Pekin from Batavia where I'm at. I go, Pekin.
Yeah, I would say, we've been giving, we've been doing as much of this vaccine work as we can based on the amount of vaccine we have. Um,
Right.
yeah.
Yeah. Well, anyway, I got to tell my other, now I think about it, I got another friend who's registered with Meyer, but I got to tell him to go over and register with you guys. He's a 1B. Uh,
Sure.
so we got to get more people registered. I got some teacher friends that got to get registered.
Hmm.
Um, So we just got to do more of it here. And like we said, we got that down in the corner there, at the bottom there, I should say, to where you can get signed up to get going on this, to get registered. And we're really happy with the VNA, what they're doing. And if they don't have insurance, can they still get in this
Oh,
idea?
yes. Yeah. Yeah. Thanks for bringing that up. There is no, we're not billing insurance, and there's no charge.
So just remember that, folks, too. And we got to get our black and brown communities too. It's been lower. I'm sure it's coming up some here because I know of some instances, especially in the black community. I know of some efforts that have been that way, but uh, still the Hispanic community and just
Yeah. BNA's done a couple events with the city and support of Kane County Health Department and DuPage County Health Department. One specifically for the Black community that we did. One for the Hispanic community. That's this week. They were uh, there was a special sign up for that, so it's filled now. But there will be additional events that VNA will have in addition to our vaccine clinics that we hold at our facilities.
sort of like similar to the food things we call them pop-ups, right? Or
Yep,
so
yep.
it's the term they use with the food stuff, pop-ups.
Yeah,
I guess that's because of the canopies, because they pop up.
yeah,
But I guess that's where
yeah.
that came from. I don't know, but they use the word pop-ups quite a bit with the food thing. So I know I've seen that with the vaccinations too. They use the word pop-up. I go,
Uh-huh.
oh. So anyway, no, we should have more of those. We just want to get everybody to get vaccinated, and you're doing a
Mhm.
great job in the community there, and we just so much appreciate that. And like I said, here's that site again. You can see it here. We got it just a little bigger here, maybe. VNAhealth.com, COVID, and then COVID dash vaccine. And just click on that and get yourself registered. And then, well, you probably can make this out if you're a computer person. That's the general website there
Yeah.
at vna.health, vnahealth.com.
Mhm.
So those are the things, and I just appreciate you coming by with us, President Linnea, and visiting with us. And
Well, I appreciate you asking me, and it's
I'm
been
sorry
great.
I don't have my script up to say thank you, but I'll say it myself here 2 times or 3. Thank you, thank you, thank you.
Well, thank you for having me. I appreciate
Thank
it.
you for coming by our way, and we'll hope people get more
Yep.
could get more on about what's happening here with the VNA and telling your friends this is an appointment. It's beautiful, and we know it's consistent. So that's one thing, and they're doing a consistent job in the community. So let's get registered and keep it going here. And
Sounds good.
on
Thank you.
Friday, we're going to have a friend come by from the food pantry, Diane Renner. Lord willing, we'll see. I think that's how that's going to work out on Friday with Diane Renner, and she'll tell us more of how that's a pandemic and things are happening and how that's a community-wide too. But so I just thank President Linnea for coming visiting with me today. And I just remember the VNA, and they need your help, and they need your prayers. They need we just need to keep going here on helping the community, and they really appreciate it for what they're doing in our community. And thank you again,
Thank you.
President Linnea.
All right. Have a good day.
Yes, thank you much. God bless everybody out there, and bye bye till next time. Bye bye.
Bye now.